Dr. Mallika, let's get right to the first question. Ray asks, if you cannot get back for your second shot within the suggested time, what do you do? Is there some way I do not have to start all over?
Yeah, so even if there's a delay in getting that second shot for several weeks, even up to 6 weeks, the CDC says you do not need to restart your series. So just go ahead and get your second shot when you can.
Flojo writes, my husband and I are in the 65-plus age group trying to get the vaccine. Now that restaurants and other venues are opening up with unlimited/limited capacity, can we go to these places and not be too concerned about getting COVID?
So first of all, I wouldn't change your behavior at all until you both are fully vaccinated. But even then, the vaccines are effective, but not 100% effective. So you still could get infected. So you just need to sort of weigh the risks and benefits of each activity that you want to consider doing. I certainly would continue to wear your masks and socially distance wherever you go. Indoor dining is difficult. And I hate to say this because obviously I want restaurants to have a good, robust business. But when you go to an indoor restaurant, you have to take your mask off. And so I would think twice about eating inside a restaurant, and I would opt to choose to dine outdoors instead.
Well, Patricia says, I previously had Guillain-Barré syndrome in 2001. I am afraid to take the COVID-19 vaccine shots. Is it safe for me to receive the shots?
Yes, according to the CDC, you can get either the Pfizer or Moderna vaccine, even if you've had Guillain-Barré in the past.
If you've received 2 doses of the vaccine, do you think it's safe to go away on vacation? I'm thinking about going to Florida at the end of April, but not 100% sure if it's the right decision.
Yeah, so again, like I was mentioning earlier, the vaccines are very effective. They're not 100% effective, so there's always a chance that you could get sick with COVID-19, even though that risk might be small. But you might decide, hey, that's risk I'm willing to take because I need to get the heck out of Dodge. I need a change of scenery. I really want to go someplace warm. I will caution you, however, just be really careful when you travel. Wear your mask, socially distance, but realize that there are some states that aren't quite as conscientious as we are here in Massachusetts and in New England, so just be very careful when you go out of state.
Another viewer asks, why isn't multiple sclerosis on the list for underlying health problems for the COVID-19 vaccination?
Well, you know, according to experts, having multiple sclerosis alone does not increase your risk of COVID-19. However, there are some patients with MS who, because of physical limitations or their underlying physical condition or because of medications they might be taking, could be at higher risk.
All right, Dr. Mallika Marshall, thank you so much. Dr. Mallika offers her best advice, but as always, consult your personal doctor before making any decisions about your health. If you have a question for Dr. Mallika, reach out by email, drmallika@cbs.com, on Twitter @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.